Hey everyone, I'm Dr. Jacobson, your go-to board-certified plastic surgeon right here in sunny Beverly Hills. Buckle up because in my practice, I've seen it all. From jaw-dropping transformations to some truly unforgettable procedures. It's been quite the journey and I can't wait to share it with you. Join me on the Beauty Blueprint, where we'll dive into cutting-edge procedures and techniques in the world of cosmetic plastic surgery and explore everything you need to know about the overall health and wellness. But that's not all. I've lined up some exciting guests who will share their insights on various aspects of health and beauty, making every single episode packed with valuable information and fun discussions. So grab your coffee and get ready to join the conversation every Sunday morning at 7:30 a.m. right here on Go Country 105. You won't want to miss a moment.
Good morning, Go Country listeners. We're happy to have you back again with us this week for part 2 of mental health and plastic surgery. With me right now, I have my co-host, Dr. Jacobson, and Dr. Judy Rosenberg is joining us once more. Thank you so much for joining us again.
My pleasure to be back.
Thank you, Dr. Rosenberg. I'm so glad to have you back. I think the topics that we're talking about in the last episode and this episode really connect with a lot of people, and a lot of our listeners were actually excited about these topics. We got a lot of requests to talk more, so that's why we wanted you to have on our show another episode of Dr. Judy Rosenberg.
Well, thank you very much for having me back, and we are going to be delving into some heavy-duty subjects today. Okay, so I'm going to turn the tables. I have some questions for you guys, and my first question is, what do you think your parents ingrained in you?
That's a very good question. I know you're touching on a really deep topic. And after our last episode, I started to think about that, and I remember my dad always emphasized school and my grades so much that I think I started to see my worth in my father's eyes in my grades. And well, on one hand, yes, it kind of pushed me to do well in school, but also sometimes it was never enough, because that's not the treatment, you know? And I think that was, well, what ingrained in me. And now I keep measuring my performance based on these numbers, which I don't think should be like that.
So it's interesting because we're talking about plastic surgery, but this is just as applicable, because with a body dysmorphic person, they don't ever look good enough. In your situation, there is a not good enough, but it's in the category of I can never be good enough with my grades or my performance or anything to do with achievement. Yes. So basically, if I were to sum it up according to core beliefs, perhaps one of your core beliefs is that I'm a human doing rather than a human being.
That's a great way of putting it. Yes. Wow, you're good, Doc.
Thanks. I love this work.
Good. So, what about you, Ashley?
Well, this is really deep, but I think that my parents ingrained that you can never be too rich or too thin. And I think that is why I've become the workhorse that I have been, because no amount of money is going to ever be enough. And no amount of being as thin as possible. And you can't get, to the point where I'm sickly thin, and it's still not enough. And I think it's because as a child, where I wish my parents pushed me academically, they pushed me to depend on my looks. My looks were gonna get me everywhere in my life. I graduated magna cum laude from college, and they didn't show up to my graduation because it wasn't summa cum laude. Oh, wow. So I graduated and I walked that stage by myself because it wasn't good enough for them. But now if I were walking across the stage and it would be something due to my looks, like a runway or something, they would have shown up. They would have been there, but they weren't there. So I graduated college alone.
Oh, wow.
But yeah, I think they ingrained in me you can never be too rich or too thin. And that is what I've taken in with me as an adult.
So that registered, and you inherited their core beliefs and you made them your own.
Yeah.
Yep. Okay, so part of the work is that we have to free ourselves from the past, because if we don't free ourselves from the past, we're at the effect of the past and we become prisoners in essence.
Right.
So you mentioned something about being too thin. You're never thin enough. You're never, what was the other one? You're never...
rich enough.
Never rich enough.
Not, there's no such thing as not enough money. Always be making more money. Could always be working harder. And at the end of the day, being that I'm older now, I've had it all, I've lost it all. I've had it all, I've lost it. I've had the houses, I've had the cars, I've had nothing. And I'm always striving to be thinner. I'm always striving to, hair, makeup, beauty, plastic surgeries. It's never enough because I don't feel pretty because I'm always, trying to hit the next mark. And it's kind of just exhausting. It's easier to be in bed underneath the covers and not have to show up and show out to the world because it's so exhausting.
And that's why I refer to this as a bad blueprint. Because look at the blueprint you're following. It's running you ragged. And not only you, the entire society. How many people out there think they're not thin enough and not rich enough? And who capitalizes on that?
Yes, makeup companies, some plastic surgeons, and clothing industry.
Yep.
Diet industry. And, speaking of being thin, something that just popped to my mind is, so we know about weight loss surgeries, gastric bypass, stomach stapling. They're very good for your health because they help you lose weight. It brings down your cholesterol. It treats diabetes for people who are really obese. It increases your overall health. However, study after study has shown that patients have a higher chance of suicide after these surgeries. That is the only comorbidity that increases after the weight loss surgery, which you would think you should be the opposite. They lose a lot of weight, they should be feeling better, but it seems like it doesn't. So that goes along with what you're talking about. What do you think that could be from?
Well, I think that there are obvious effects of surgery that cause people to be down and out and depressed. Mm-hmm. And then the expectation that their life is going to change as a result of their weight loss. And they're still the same people and they still feel the same about themselves. And remember the cracked lens of perception that I spoke of last time?
Yes.
There's the cracked lens of perception. They look in the mirror, and although logically, see, I have a concept that I talk about. And by the way, for those of you who want a free copy of the PDF of my book, okay, it's called Be the Cause: Healing Human Disconnect. I wrote it many years ago, and you can have it. It's on my website. You can ask for it, Psychological Healing Center, and it'll break it all down. Okay, so you don't have to remember this stuff. I've written it all out for you guys.
Ever wish you could redesign your look even just a little? Meet board-certified plastic surgeon Dr. Joshua Jacobson, the architect of beauty. His expertise transforms your vision into reality. Whether you're dreaming of a subtle enhancement or a dramatic change, Dr. Joshua Jacobson can meticulously blueprint your ideal self. Don't wait, contact us today at 424-465-3800. That's 424-465-3800.
So there's logic and there's psychologic. I talk about it in the book. The logic of the psyche is different than logic. So you might look in the mirror and see somebody fat and see somebody distorted or see little pockets of cellulite or think that your skin is too wrinkled or whatever you're seeing, okay? Whose eyes are you looking through?
Well, I would assume mine.
They're not.
My parents.
Right, you're wearing the psychoperceptual lens of your parents. And that's the psychological work that I delve into. Got to take the glasses off. The neural pathways are being laid down foundationally. I have a little granddaughter. I also have a grandson, and I'm now watching my little granddaughter who's 14 months old, and the amount of cuddling and responsiveness and containment and boundaries and safety and emotional safety she gets. And I'm thinking, wow, if the whole human race can just use this as a model for psychological development, we wouldn't be talking today about body dysmorphic disorder.
That's true. That's a great point. So I know in the past several years, in the hospitals, in the maternity wards, what they have actually started doing is once the baby is born, they want skin-to-skin contact,
Exactly.
baby to the mother.
Yep.
And they actually make it a regular schedule where they bring the child also over the next few hours to make sure there is a lot of contact. That's one. And the other is they're encouraging breastfeeding a lot.
Yes.
Much more than in several decades ago, because they say that's one of the ways that the child connects to the mother and feels attached.
Absolutely.
One of the well-known surgeons that I worked with, not a plastic surgeon, a different specialty, very busy. Her husband was also very busy. They were both surgeons, and they didn't have enough time for their children. So one time her 5-year-old came to the hospital, just to hang out, and we were talking to her, and we said, oh, what do you want to be when you grow up? And we thought, well, she has such a great mother, well known, she must be getting great care. So she said, well, I want to become a patient when I grow up. We're like, why? She said, because I want to see my mommy.
Wow.
And that really made us all say, wow, that's how important it is. A lot of times your children are not going to be thinking, oh, well, my mother is this, that's why I'm so happy. It's more that how much my mother gave me love.
This is such a delicate topic. And when you said about the little girl who wants to be a patient, I'm thinking of you, Ashley, because what did you want to be when you grow up? You want to be a thin girl with big boobs.
Yeah.
Because you want your father to love you.
Yeah.
And what did the little girl want? She wanted her mommy to love her and give her time. So she wanted to be a patient. So do you see how we will throw ourselves under the bus to get what we need from our parents?
Yeah.
Which they should have given us in the first place.
Are you ready to achieve the body you've always dreamed of? Look no further than board-certified plastic surgeon Dr. Joshua Jacobson. Dr. Joshua Jacobson offers a range of surgical procedures to help you look and feel your best. From breast augmentation to tummy tucks, our skilled team will work with you to create a personalized treatment plan designed to meet your individual needs and goals. Let us help you achieve the confidence and beauty you deserve. Don't wait. Contact us today at 424-465-3800. That's 424-465-3800.
Obviously, we don't have control over how our parents treat us. We don't have any control over things that happen to us. But I feel like we can work on that, with a professional mental health doctor or specialist who can actually help us overcome a lot of those and be a better person and feel better about ourselves.
When I was a teenager, maybe it was in my early 20s, somewhere around there, was at a diner with my father eating, and I got up to go to the restroom, and he said, "Girl, you have some thunder thighs on you," and I never forgot that, and it stuck with me so much that I ended up actually buying illegally online a research peptide that was shown to put lesions on kidneys, on monkeys' kidneys. It was not meant for people. It was not meant for like a human consumption. It wasn't even legal. I got it, I bought it, and I put lesion, because it's supposed to cut off the blood vessels to your fat. And so it was like immediate weight loss. And I was doing this so my thighs would go down. And I ended up putting lesions on my own kidneys, and it was the most painful thing. I had to inject it, but I ended up having to get on different medication then in order to get the lesions off my kidneys. And that was all just because my father told me I had thunder thighs. I was hoping, hey, this peptide might work, and I won't have to deal with this anymore. I'll lose weight and it's going to be perfect. But could you imagine, how dumb and how stupid that was?
But now you're talking about a really dark side to this, right? Yeah. Imagine how many people like you are doing things, injecting injectables that are not even legal, so that they can have bigger lips or bigger boobs or bigger cheekbones or whatever they're doing. I don't know what they're putting in themselves. Dr. Jacobson, maybe you can answer. What are they putting in themselves that you have to then remove?
Yes. So unfortunately, there are, in the past and still now, there are all these non-licensed people who do procedures in their basement, and what they do is they inject commercial grade silicone into people's buttocks, people's breasts, people's lips, and initially it looks good, but after a few years your body starts to have this really bad inflammatory reaction. So these areas get really hard, you start getting these weeping wounds, and I've seen some really disfigured people because of these. And no licensed doctor in the United States would do this kind of thing.
And it brings to mind people who may even be able to afford you and go for help within the next few days, but they're standing in front of the mirror looking at themselves thinking, wait, I have a date tonight. I've got to look good now. And they're pulling that stuff out of their closet and injecting themselves immediately because this core belief is so strong. I'm not good enough. I'm not pretty enough. I'll never be lovable. And they're injecting hope into their system. If I have this, or I have the cheekbones or the jawline or whatever, then I will be lovable.
Yes. And actually, you've seen me turn away patients, and you tell me, well, why can't you help them? Why don't you do that? And it's because I see some of these red flags, and I don't want to put scars on their body and not be able to help them.
I keep saying, and I am one of these people. So being that I'm 38, I'm single, not married, and I don't have my children yet. And that's something that we've said in other episodes I really, really want. And now I'm saying, well, I'm not even going to go out and try to date until I get my lower facelift because no one's going to love me. Like, no one's going to want to marry me until I get my lower facelift. And I'm right here looking at you like, and my girlfriends are all like, well, until, he's not going to fall through your ceiling and land on your couch. You're going to have to go out to meet him if you want to get married, Ash. And I'm like, well, it's not worth it right now because I really need my lower lip. I might need a temporal lip. And then I'll go out once I'm pretty again. Then someone's going to love me. Then I'll finally get to get married. And then I'll finally have kids. But until then, seriously, and this is why I keep telling you, Dr. J, I need a lower facelift. I need the time off. Or I'm never going to get married and have kids.
And what do I tell you?
No. But he also tells me I don't need anything done. And he refuses to. You'd think working for a plastic surgeon, I'd get some good deals, or no, he won't. He refuses to work on me or do anything on me. So I picked the wrong plastic. No, I'm just kidding. I'm just kidding. I'm just kidding.
I have done surgeries on people that have worked for me in the past, but very rigorous selection process, and it took me some turning away until they convinced me, and it was only for legitimate reasons. You will never be able to convince me to do a lower facelift on you at this point.
And especially after this discussion, sorry, now I really blew it for you.
Yeah.
Okay?
Yeah, it's okay.
Because until you dismantle this psychological cancer, seriously, okay?
I just don't understand then what's wrong with me. If I'm 38, and how come no one's loved me enough to marry me yet? I'm smart, I'm hardworking, I'm a Christian, I'm a God believer, I work hard. Why? It's got to be what I look like then. I'm like what my parents always said. I'm like, well, the only thing I can fix now at this point is either internally, my heart and my spirit, or physically.
And the physical is always easier. I mean, look, you asked me earlier about treatment plan, and in order to go into the treatment plan of dismantling all of these negative core beliefs and childhood wounds, we really have to face up to the cause. And the cause is always the family blueprint, because this is multi-generational.
Yeah.
Yes.
So we have to confront the multi-generational damage, which is always nasty for people, because who wants to think that their own parent didn't do a good job? Yes. However, we have to go there, and without blaming and shaming the parents, we have to show people that this psycho-inheritance is now trickled down to them, and we've got to break the curse.
Yeah, and Dr. Rosenberg, I'm a big proponent of mental health and seeking mental help, even for anyone that doesn't even think they need it, because I think that you always could use it. And unfortunately, in the past, the society has had this negative connotation of psychology and therapy. The therapist, they think, well, sorry for this term, but crazy people go to therapists,
Right, not in
stigmatized.
California though.
In California,
everybody goes to a therapist.
That's true.
In Chicago, it's still very, very stigmatized.
Yes.
Oh my gosh. When I told people that you were coming on my show, they're like, who really sees a therapist? These are people from Chicago. I'm like, everybody has a therapist. I love seeing a little, like a 4-year-old or 5-year-old, 6-year-old going, well, my therapist told me. And I was like, oh, look at you, girl, you go. And so that out in Chicago, very stigmatized. So you don't talk about it. Everyone goes, but no one talks about it.
I liken it to having a primary care doctor. You're not going to know if your blood pressure is high, if your cholesterol is high. You have to go to a regular checkup with your primary doctor. Why don't we think about that in the same way about our mental health?
Because our mental health is dictated, again, by the blueprint of our parents. So even if I, as a psychologist, say to you, oh, you're beautiful, you're thin, your lens of perception is cracked, the parents set the bar. You don't listen to my words. So my words, that's why talk therapy isn't the best method. So if I say, oh, just loosen up, okay, you're fine.
I hate when
You're
people say that to me.
beautiful. And you know why you hate it? It's because at the core it doesn't resonate.
Exactly.
So
like
if I
putting a
said to
Band-Aid.
you, right, so what would resonate more to you is, I hate to tell you this, but you're not a very good looking person. You're a little too fat, okay? Your jawline is dropping, and you need bigger boobs, and I could see some rolls of cellulite. Now, look at her shaking her head. I know you're hearing us and not seeing us, but Ashley's actually shaking her head.
I love that. I love when people
everything-
critique me like that and say, you know what, your jawline used to be a lot sharper back in the day, and now, I like that when people because it means that I know what to go work on and what to fix. I don't like hearing, oh, you look great, you're fine, you're beautiful. No, that's not good enough. What can I do? What do I need to do?
Because my words, even though I obviously made them up, resonate because they match the words that your parents said to you, and now they match your core beliefs. So you're going to internalize what I say and reject everything else that's not that.
Right. Yeah, I agree.
Do you have questions you would like answered on the Beauty Blueprint? Call us at 800-734-0040. That's 800-734-0040. And leave a message with your comment or question, and we will answer it on air. Then tune in every Sunday morning at 7:30 to the Beauty Blueprint right here on Go Country 105.
Okay, so now I have another question for everybody. When was a time in your life that you felt really comfortable in your own skin?
I will go first. I don't remember the last time I've ever felt comfortable in my own skin.
Okay, and I have a couple comments about that. So there are two phases of development. I mean, there are lots of phases of development, but for simplicity's sake, there's the pre-verbal phase, and then there's the verbal phase. So pre-verbally already your parents were giving you messages that you're not good enough, even though they didn't have words to say it with. And then verbally, when they did have the words, then it really got in there. It just locked itself in. Okay, so there wasn't a time that you had a good internalized view of yourself. That didn't exist. So Ashley never felt comfortable in her own skin.
Yeah, that makes sense. What about you, Dr. Jacobson?
Well, probably the only times would be if I would ace an exam, because then I would think, oh, my dad is going to be proud. But I remember one time I brought my report card and I had aced everything, and I think on one thing I had an A-, and he's like, oh, wow, that's good. What about this A-? What happened there? And there it goes.
And that's I'm connecting the dots again. So that's what body dysmorphia looks like. Oh, look, my skin looks really good, but how about that little tiny A- sag right over here? So although you don't do it with the physicality, you do it with your performance.
Yes, with school.
You see that?
Oh,
Yes.
this explains a lot now.
Yeah.
This
You see
explains
that?
a lot now.
Yeah. You see why I get stressed?
Yeah, I'm like, doctor, I'm like, you're fine. Everything's gonna be fine. I'm always trying to take a deep breath. Take a deep breath, Dr. J. And now I see why now.
Yeah. So this is actually helping me relate to a lot of the patients who feel the same about their looks, and I think this is going to help me put myself in their shoes and relate to them and sympathize with them.
I just talked to my Aunt Sandy's in Dallas, and when I told her that I got this job, she was happy, but she goes, I have a very, very strong concern. She goes, you've already, are down the route with plastic surgery. I'm afraid of how much more you're going to get because of this job. And in a nice way, she was saying, you don't need to be in plastic surgery. You need to get away from it.
I like your aunt. See?
Yeah.
She should be glad that you're working for me, because I'm not going to do useless surgeries on you.
I know. I told her, I said, first of all, there's only one of me. There's no one to replace me for time off. So I have no time to go get anything done if I even wanted it. But also, it made me, seeing other people that come in, especially my age or even younger than me now, it has changed my ideas about, wow, maybe I'm not so bad.
Well, you were talking earlier to me about a belief in a higher power, going to church and that. So if everything is not a coincidence, okay, even the fact that you went to work for a plastic surgeon is not a coincidence, and that you went to work for an ethical plastic surgeon, and now you're hearing about body dysmorphia. And so all of these coincidences are now psychoeducating you about this.
I feel like I got a degree in healthcare because I couldn't help my parents and I couldn't help myself. So I felt the need to go in a career where I can help everyone else.
Yes.
I really do feel like that's why I chose healthcare. And it was, that's just the honest, harsh truth.
So imagine if you were the most beautiful creature on the planet. I don't know who's the most beautiful creature out there. I don't know.
I think it's very subjective.
Yeah,
every year it's a different magazine cover.
Yeah. I can't even define it. And let's say you waved a magic wand and you were A+++++. Now what?
Then I'd start working on the next thing.
Like what? What's the next thing? Now your skin is perfect, your body is perfect, your boobs are perfect, everything's perfect. Now what?
I feel like I make categories in life of, okay, you've got your work category, you've got your physical appearance category, you've got your spiritual category. I would probably pick a category and then try to get that level of the highest, and then move on to the next thing. I'm constantly not living in the present. I'm in the present worrying about the future and trying to get more and more and more, and not realizing what I have here now.
Okay, so now let's pretend you're on a date.
Okay.
Okay.
Oh gosh. Okay.
And the guy is looking at you. And you ask why you're single. Okay, so he's looking at you and you're looking at him looking at you. And what are you thinking? You're thinking, oh my God, he's looking at my jawline. Oh
I ask Dr. Jacobson this all the time. I'm like, Dr. J.
God.
Yes.
Oh my God.
I'm like, wait, can you look at this? Can you look at this? What do you think? And he's like, I'm not seeing anything. I'm not your doctor. Blah, 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 blah. And I'm like, no, but I need your eye. I want you to see something. Do you think I need this? Do you think I need that? And I'm like, just look real quick. And I do have something I need you to look at. But he's like, no.
Okay, so actually, let me ask you something. Let me ask you something. So if you're doing all of that in your head, because what you're really doing is saying, are you like my father? Do you think I'm beautiful?
Yeah.
Uh-oh, you're dangerous, because if you think something like what my father thinks, you're not going to love me. And if your head is all filled with all that in a bag of chips, okay, then what's going to happen? Do you think that you're making a connection with that guy?
No, I'm not.
Not at all.
No.
It's a disconnect.
Yeah.
Okay?
Yeah.
So he might be sitting there, but guess who's being really ignored?
He is.
He's being ignored.
Yeah.
Yeah. Well, Dr. Judy, thank you so much. This was such a deep conversation, and I really hope our listeners enjoyed it. And please, if you want to seek help, especially from Dr. Judy Rosenberg, contact her, or you can also contact our office at 424-465-3800. That's 424-465-3800, and we will be glad to put you in touch with her. And I'm already getting a signal from my producer that it's already time to wrap up. Thank you for tuning in to the Beauty Blueprint. I think this was one of the best episodes we've had. I hope you enjoyed hearing about mental health aspect of plastic surgery and mental health in general. And make sure to tune in every Sunday at 7:30 a.m. on Go Country 105 FM. Listen and learn everything you want to know about plastic surgery, whether you've had it done or you want to have it down in the road. And as always, if you have any questions or if you want to book a consultation, give us a call at 424-465-3800. That's 424-465-3800. Thank you. See you next time, same place. I'm Dr. Joshua Jacobson, your beauty architect.